This is Sri Nagesh, a board-certified plastic and cosmetic surgeon based at 𝐲𝐨𝐻𝐧 Hyderabad. Today, I shall discuss with you the roles of hormones in lipedema. Lipedema, as you know, is a connective tissue disorder which often starts around puberty and progresses through pregnancy and menopause. It also is more common in women than in men. So this is one of clear indications that there are some hormones which are playing a crucial role in the development and the progression of this particular condition called lipedema. And lipedema is a disease of the fat also. So it's otherwise called the painful fat syndrome. So and there is an abnormal deposition of fat in certain areas of the body specific to women. So like a gynoid, there are two types of fat deposition. One is an apple-shaped body and the other is a pear-shaped body, as everyone knows. And it's a typical pear-shaped or otherwise called a gynoid type of a body, which is typically seen in a typical case of lipedema, not accompanied by obesity. So, in short, hormones do play a very significant role in the development and progression of lipedema. So, though the exact mechanisms of hormones in lipedema are not fully understood, but it has been identified that some of these hormones have a lot of influence in this condition. Now, let us see what are the hormones and what role do they play in this disease called lipedema. The number one disease, hormone that is responsible for this lipedema is estrogen. It starts at puberty, and that is the time when the estrogen, there's a surge of estrogen levels in the body, and that is the time when there is the onset of this condition. The next stage where estrogen plays an important role is during the periods. Every time there is a period, there is a surge of lipedema and there's also a surge of progesterone. So this estrogen plays a role even during or in between periods. So next is pregnancy. Many women also report a worsening of the situation if it's already existing, lipedema is already existing, or lipedema could start, the onset of lipedema can start during pregnancy. So this is another time when there is an elevated estrogen level. The third time is menopause. There is a lot of hormonal changes that take place during menopause and can impact lipedema. And estrogen levels fluctuate very greatly and then suddenly start to decrease in the levels in the body as menopause sets in and the periods ceases to exist. So during the perimenopausal times, there is a lot of women, they have premenopausal symptoms like hot flushes and so many other conditions, irritability, anger, depression, and all those things. These are the other times when estrogen also there is a lot of fluctuation and causes a flare-up of lipedema. The next culprit hormone that is responsible for this lipedema is progesterone. There is a cyclic fluctuations of progesterone just like estrogen during the menstrual cycles. And each time there is an increase in estrogen level, there will be an increase in the decrease in the progesterone level. There's a decrease in the progesterone level, there will be an increase in the progesterone level. This kind of up and down movement, these changes which correspond to the menstrual cycle can also influence the condition. So estrogen and progesterone, of course, they go hand in hand in the development of lipedema. The next comes insulin. Insulin resistance is a condition when women with lipedema especially, they tend to exhibit insulin resistance. They're resistant to the insulin that is secreted by the body. So, which can exacerbate the deposition of fat and also cause initiate an inflammatory reaction. So, the fat becomes inflamed, becomes swollen, becomes angry looking, and and because of that, it attracts other factors, and the fat accumulation increases, especially in the lower body. It has been seen that it starts off more in the lower body than in the upper body. Then associated metabolic syndromes. That also is there's a metabolic syndrome is a cluster of diseases like PCOD, obesity, thyroid, and so on and so forth. All of them, are interrelated, and insulin plays a very important role in the metabolic syndrome condition. Next comes the thyroid hormones. It is usually seen that many women suffering from lipedema can have hypothyroidism, that is a lower thyroid levels than normal. When you have higher thyroid levels, generally what happens is your hunger increases, you tend to eat more, but you do not tend to lose weight. And it is something like a Graves' disease. You can also have, prominent eyes popping out of your sockets, sort of a condition. So, and you tend to lose weight dramatically, grossly. But in hypothyroidism, because the metabolism becomes more sluggish, it can lead to weight gain and fat accumulation. And some of the symptoms of lipedema can get exacerbated in this particular condition. Then next comes cortisol. Cortisol is a stress hormone. So, in response to stress, that is, when there is chronic stress, cortisol levels increase. And when this cortisol level increases, there is a tendency to attract and deposit more fat in that particular area, along with inflammation. So, high cortisol levels are generally associated with weight gain, especially around the abdomen and the back of the neck, the nape of the neck, or it's otherwise called a buffalo hump. But the same hormone, cortisol, in presence of lipedema, can initiate and start increasing deposits of fat in the hips, buttocks, thighs, legs, or the arms. So, fat distribution is very much dependent on various hormones like estrogen and progesterone. They are known to influence the distribution of body fat, especially in the a gynoid type of a fat distribution. If you have more amount of estrogen and progesterone, you don't tend to put on weight on the face or on the neck, but you tend to put on more amount of weight maybe on your breast, on your hips, on your thighs. So the vascular and lymphatic system, these also can be affected by the hormones. So estrogen, for example, shows increased vascular permeability. So there's more amount of bleeding, and the lymphatic function also seems to be influenced, and there tends to be a potential for fluid accumulation. So usually when patients, you see some of the women who take oral contraceptives, they have often a complaint saying that they feel heavy, they feel bloated, and they feel heavy on their legs. So this is a typical symptom of there's the effect of estrogen on the body. And another key feature is chronic inflammation. More amount of these hormones, especially estrogen, they can initiate and trigger inflammatory processes in the adipose tissue, causing the tissue to become more fibrotic, and more amount of fibrosis, the progression of lipedema and the severity of lipedema keeps on increasing. So we need to understand the hormonal impacts of lipedema and its treatment program. Now, it is very essential for us to be able to manage the hormone levels through medications or lifestyle. So, for which you need to approach an endocrinologist who can, investigate and diagnose and treat these conditions accordingly. Uh, Regular exercise and diet, especially a diet low in anti-inflammatory foods and regular physical activity, can help in managing insulin levels and reduce inflammation. Stress management of stress is very, very essential. And you know uh, meditation, mindful therapies, and lifestyle changes, these can help lower cortisol levels and to a certain extent mitigate or lower the symptoms of lipedema. Hormone therapy, like I already mentioned, you should either meet an endocrinologist who can help you with this, or also meet a gynecologist who can do a proper hormone replacement therapy, especially if you're having irregular periods or going through a perimenopausal age. So, they can help you manage with the symptoms and also bring down your stress levels, the inflammatory levels, insulin resistance, and your hormones into proper balance, and so that the symptoms of lipedema also do diminish. So, so much for the hormones today. I think it's been quite a tiring and session, and wish you all the best. If you have any further queries, please feel free to contact 95151 or come over to a clinic for a consultation at 𝐲𝐻𝐴𝐧 Aesthetic, Madhapur, Hyderabad, or you can also log on to our website www.lipedema.in. Thank you.